All right. 5 countries with the highest cesarean section rates in the world. 5 countries with the highest C-section rates in the world. I am Dr. Fatou Forna. I'm an OBGYN who works to keep pregnant women safe here in the US and around the world. And today let's talk about these countries that have high C-section rates. We all know that a vaginal delivery is the best thing for most women, best for mom, best for baby. But we also know that C-sections are life-saving procedures that are needed in many cases to save the life of a baby or to save the life of a mom. So worldwide, most deliveries, 80% of all deliveries are vaginal deliveries. About 20% are cesarean sections. In the US, 70% are vaginal deliveries, 30% are cesarean sections. That's considered a little high. We're working really hard to decrease that C-section rate. But there are 5 countries that really take C-sections to a whole other level. Just like really high, where the majority of deliveries are by C-sections. So let's talk about these 5 countries with the highest C-section rates in the world. Number 1 is Egypt. In Egypt, 72% of all deliveries are by C-section. That blows your mind. I was in Egypt, about 2 to 3 weeks ago, and talking about this in depth. And I was shocked. And this is something recent that happened. 20 years ago, this wasn't the case. So Egypt has, according to their Ministry of Health, 72% of all deliveries are by C-sections. All right. Number 2, Cyprus. In Cyprus, 61% of all deliveries are by C-section. Number 3, Turkey. Turkey also has 61% of all their deliveries by C-section. And then number four is Dominican Republic. In the Dominican Republic, 60% of all their deliveries are by C-section. And then rounding out the top 5, Brazil. In Brazil, 56% of all of their deliveries are by C-sections. And actually, in their private institution, 90% of all the deliveries in their private institutions are by C-sections. So really high cesarean section rates. Most babies are delivered in these 5 countries by C-sections, not by vaginal deliveries, which is very different from the rest of the world. There are many reasons for this. There are patient factors. For some reason, societal norms have changed, where women are choosing to have C-sections, whether they're scared of pushing. They think it protects their vaginal area and their pelvic floor. And I just want to let people know that that's not true. Stuff like incontinence, all of that, it happens whether or not, just from being pregnant. It's not the act of pushing by itself that does that. The vagina stretches, it comes right back to normal. So we shouldn't be really scared about that. But some people think that they want to keep their vagina tight, and they're opting for a C-section, which hopefully we can educate people enough to let them know that that's not a reason and that it snaps back to the way it was. I really do think that people who are choosing C-sections might not understand how risky it is during this pregnancy and for all of their future pregnancies and deliveries. There are also physician factors. There are times where this is driven by physicians. It is much easier and quicker to do a C-section. You can do a C-section in 30 minutes, be done, and move on. Whereas to have a vaginal delivery can take, 6 hours, 8 hours, 12, 24 hours, 2 days. But you have to be patient to make sure that you're giving a woman the best chance and not just rushing, so you can go back to clinic or do other things. So there are times when there are physician factors. In some countries, you're paid more to do C-sections. It's not really as much the case in the US. There are times when you might be paid $100 or $200 more for a C-section or $400. That's not enough financial incentive to push people to do C-sections in the US, I think. But in some of the other countries, they do pay a lot more for cesarean sections. But this is interesting information that we should all be aware of, because cesarean sections are associated with 3 times higher risk of death. 3 times higher risk of death than a vaginal delivery. So women, we really, in most cases, the vaginal delivery is best for you. It's safer for you. And then the more C-sections you have, the higher the risk anyway. So it's a reminder to all of us that we need to do more to keep our C-section rates down, to promote vaginal deliveries, because we need you to survive and thrive. All right? All right. Bye-bye.